Have you ever opened your medicine cabinet and felt overwhelmed by all the bottles staring back at you? Maybe you've wondered if all those supplements you're taking are actually working together or working against each other. I recently met Martha, a vibrant 72-year-old who prided herself on her health routine. Every morning she lined up her supplements on the kitchen counter: calcium, vitamin D, fish oil, a multivitamin, iron, magnesium, and a handful of herbal remedies recommended by friends. She took them all at once with her morning coffee, believing she was doing everything right to stay healthy. But then something strange happened. Martha started feeling unusually tired. Her stomach bothered her constantly. Some days she felt so dizzy she was afraid to drive. When she finally visited her doctor, what she learned shocked her. Those supplements she thought were keeping her healthy, some of them were actually fighting each other inside her body, cancelling out benefits and potentially causing harm. Martha's story isn't unusual. Across America, millions of seniors are taking multiple supplements daily without realizing that certain combinations can be ineffective at best and dangerous at worst. Recent studies show that over 70% of adults over 65 take at least one dietary supplement, and nearly 30% take 4 or more. But many are completely unaware of the potential interactions. Today, I'm going to reveal the 4 supplement combinations that doctors are urgently warning seniors to avoid taking together. These aren't obscure supplements. They're some of the most common ones you'll find in medicine cabinets across the country. I'll explain exactly why these combinations are problematic, what happens in your body when you take them together, and most importantly, what you can do instead to get the benefits without the risks. I'll also share with you 3 simple strategies that can help you maximize the effectiveness of your supplements while minimizing potential dangers. And don't worry, I'm not going to tell you to throw everything away. There's a smarter approach that doesn't require drastic measures. By the end of this video, you'll have the knowledge to take control of your supplement routine, potentially saving yourself from unnecessary side effects, wasted money, and health complications. This information could be life-changing for you or someone you love. Before we dive in, I'd love to know where you're watching from today. Drop a comment below letting me know your location and whether you or someone you know takes multiple supplements. And don't forget to hit that subscribe button and turn on notifications so you never miss important health information that could make a real difference in your life. Now, let's explore the first dangerous supplement combination that doctors are warning about. When it comes to bone health, calcium and iron are 2 supplements many seniors rely on daily. Calcium supports aging bones that naturally lose density over time, while iron helps maintain healthy blood cells, especially important for those with anemia or low iron levels. Both are vital nutrients, but when taken together, they become surprisingly problematic. Let me explain why this common combination might be sabotaging your health efforts. Iron and calcium compete for absorption in your digestive tract. When taken at the same time, they essentially get in each other's way. Studies show that calcium can reduce iron absorption by up to 60%. This means if you're taking a 65 millimeters iron supplement, your body might only be absorbing about 26 millimeters when you take it with calcium. For someone like Richard, a 68-year-old retired teacher I spoke with recently, this interaction led to ongoing iron deficiency despite faithfully taking his supplements. His doctor had prescribed iron for his anemia, but his levels weren't improving. The culprit? He was taking his iron with his calcium supplement every morning, completely unaware they were working against each other. The competition between these minerals happens because they use similar pathways for absorption in the intestines. Both rely on active transport mechanisms to move from your digestive tract into your bloodstream. When both are present simultaneously, calcium, being the larger, more dominant mineral, often wins this competition, leaving iron unabsorbed. This isn't just inefficient, it can have real health consequences. iron deficiency can lead to persistent fatigue, weakness, pale skin, and in severe cases, heart problems. Meanwhile, your body isn't getting the full benefit of the calcium either, potentially compromising bone health. Seniors with certain conditions face even greater risks. Those with iron deficiency anemia might continue experiencing symptoms despite supplementation. People with gastrointestinal disorders like celiac disease or inflammatory bowel disease already struggle with nutrient absorption, making this interaction particularly problematic. And women over 65, who often take both supplements, calcium for bone health and iron for blood health, may be especially vulnerable. Sarah, a 77-year-old grandmother from Ohio, shared her experience with me. I was taking both supplements faithfully for months, but my doctor was confused because my iron levels weren't improving. No one told me they shouldn't be taken together. Once I separated them by several hours, my next blood test showed a significant improvement. So how can you safely take both calcium and iron if you need them? The solution is simple: timing. Take them at different times of the day, at least 2 to 3 hours apart. For instance, take your calcium supplement with dinner and your iron supplement with breakfast. This gives each mineral its own window of opportunity for absorption without interference. Some doctors recommend taking iron on an empty stomach for maximum absorption, though this can cause stomach upset in some people. If that's the case for you, taking it with a small amount of food, just not dairy or calcium-rich foods, is a reasonable compromise. It's also worth noting that vitamin C enhances iron absorption, while coffee and tea can inhibit it. So consider taking your iron with a small glass of orange juice rather than your morning coffee for optimal benefits. Always consult with your healthcare provider before making changes to your supplement regimen, especially if you're taking them for specific medical conditions. Your doctor might recommend specific timing based on your individual health needs and medication schedule. By being mindful about when you take these important supplements, you can ensure your body actually benefits from both without one undermining the other. It's a small change that can make a big difference in your health outcomes. Now, let's move on to our second problematic supplement combination, one that affects millions of seniors who are trying to protect their heart health. Fish oil and vitamin E. It sounds like the perfect heart health combination, doesn't it? Fish oil supplements, rich in omega-3 fatty acids, are popular for their anti-inflammatory properties and potential cardiovascular benefits. Vitamin E, a powerful antioxidant, is often taken to protect cells from damage. Both are frequently recommended for heart health and circulation. However, taking these supplements together creates a concerning situation that many seniors aren't aware of, and it involves your blood's ability to clot properly. Both fish oil and vitamin E have natural blood-thinning effects. While this property can be beneficial in preventing harmful blood clots, when combined, they can thin the blood too much, potentially increasing the risk of bleeding problems. This effect is dose-dependent, meaning higher doses create greater risks. I spoke with Dr. Melissa Chen, a geriatric specialist, who explained, "I've seen patients come in with unusual bruising or prolonged bleeding from minor cuts who had no idea their supplement routine was the culprit. Many people think that if one supplement is good for heart health, taking another must be even better, but that's not how our body chemistry works." James, a 70-year-old retired accountant, learned this lesson the hard way. He had been taking both fish oil and high-dose vitamin E daily for years, believing he was giving his heart double protection. When he needed a routine dental procedure, what should have been minor bleeding continued for hours, alarming both him and his dentist. Blood tests revealed his clotting function was significantly impaired. The science behind this interaction involves how these supplements affect platelets, the tiny blood cells that help your body form clots to stop bleeding. Fish oil's omega-3 fatty acids, particularly EPA and DHA, reduce platelet aggregation, their ability to stick together. Vitamin E inhibits vitamin K-dependent clotting factors. When both mechanisms are activated simultaneously, your blood's normal clotting ability can be compromised. This interaction becomes especially dangerous for seniors who are already taking prescription blood thinners like warfarin, Coumadin, apixaban, Eliquis, or rivaroxaban, Zarelot, have naturally decreased clotting function due to aging, are preparing for surgery or dental procedures, have conditions that increase bleeding risk like ulcers or certain types of stroke. Margaret, 75, shared her experience. My doctor was horrified when I mentioned I was taking both fish oil and vitamin E along with my prescribed blood thinner. No one had ever told me about the risks. He immediately had me stop the vitamin E and reduce my fish oil dose. I had no idea I was putting myself in danger. If you're currently taking both supplements, don't panic, but do consult your healthcare provider. They might recommend choosing one supplement rather than taking both, reducing the dosage of one or both supplements, monitoring your blood clotting function more frequently, adjusting your supplement routine before any surgical procedures. For those who want the benefits of both, focusing on food sources rather than supplements can be a safer approach. Eating fatty fish like salmon twice weekly provides omega-3s, while nuts, seeds and vegetable oils offer natural vitamin E, both in amounts less likely to cause problematic interactions. If you experience easy bruising, nosebleeds that are difficult to stop, bleeding gums, or unusually heavy bleeding from minor cuts while taking these supplements together, contact your healthcare provider promptly. These could be signs that your blood's clotting ability has been compromised. Remember, supplements are powerful substances that affect your body's chemistry. They're not just extras you can add indiscriminately to your health routine. Being strategic about which ones you take and when can make all the difference between helping and potentially harming your health. Now let's examine our third problematic combination, one that affects a nutrient essential for energy production and brain function, especially as we age. Vitamin B12 deficiency becomes increasingly common as we get older. After age 60, many people naturally produce less stomach acid, which is necessary for B12 absorption from food. This essential vitamin is critical for nerve function, energy production, and cognition. B12 deficiency can cause fatigue, memory problems, numbness and tingling in the extremities, and even depression. Symptoms often mistakenly attributed to just getting older. Because of these risks, many seniors wisely add B12 supplements to their daily routine. However, there's a common medication that can significantly reduce B12 absorption, essentially cancelling out your supplement efforts. I'm talking about acid reducers, both prescription proton pump inhibitors, PPIs, like omeprazole, Prilosec, and esomeprazole, Nexium, and over-the-counter options like famotidine, Pepcid, and ranitidine. While not supplements themselves, these acid-reducing medications are taken so commonly alongside supplements that they deserve special attention. Studies show that long-term use of acid reducers can decrease B12 absorption by up to 80%. That means your 1000 mcg B12 supplement might only be providing your body with 200 mcg of usable vitamin. Eleanor, an active 78-year-old grandmother I spoke with, had been taking a PPI for her acid reflux for years. Despite also faithfully taking a B12 supplement daily, she began experiencing increasing fatigue, occasional confusion, and strange sensations in her feet. When her doctor tested her B12 levels, they were dangerously low despite her supplementation. No one had warned her about this interaction. Here's why this happens. Vitamin B12 from both food and most supplements is bound to proteins. To be absorbed in your intestines, this bound B12 must first be released by stomach acid. When acid-reducing medications decrease stomach acid production, B12 remains bound to proteins and passes through your digestive system without being absorbed. This interaction is particularly concerning for seniors because many older adults already have naturally reduced stomach acid production. Acid reflux and heartburn medications are among the most commonly used by seniors. B12 deficiency symptoms can mimic dementia and other age-related cognitive changes. Long-term B12 deficiency can cause permanent nerve damage. Robert, 82, shared his experience. I was taking heartburn medication and B12 supplements every morning with breakfast. For months, I felt increasingly confused and unsteady. My children were worried I was developing Alzheimer's. It turned out my B12 levels were critically low despite my supplements. Once my doctor helped me adjust my routine, my symptoms improved dramatically. If you need both acid reducers and B12 supplements, all is not lost. Here are some strategies that can help. Consider a sublingual, under the tongue, or nasal B12 spray. These forms bypass the digestive system, allowing B12 to be absorbed directly into the bloodstream without needing stomach acid. Discuss B12 injections with your doctor. These bypass the digestive system entirely and can quickly restore levels for those with severe deficiencies or absorption issues. Take B12 supplements at least 2 hours before acid reducers to give the vitamin a chance to interact with stomach acid before it's reduced. Ask your doctor if you can reduce your acid reducer medication to the lowest effective dose, or take it only when necessary rather than daily. Request regular B12 level testing to ensure your current approach is working. Dr. Thomas Wilkins, a geriatric specialist, advises many seniors are walking around with B12 deficiency symptoms they attribute to aging, when in fact it's a correctable nutritional issue. The combination of natural aging changes, acid-reducing medications, and standard B12 supplements creates a perfect storm for deficiency. By being aware of this interaction and taking steps to address it, you can ensure you're actually getting the B12 your body and brain need to function optimally, even while managing acid reflux or heartburn conditions. It's about working smarter, not just taking more supplements and hoping for the best. Now let's explore our fourth problematic supplement combination, one that affects a mineral crucial for muscle function, heart rhythm, and overall vitality. Magnesium is often described as nature's relaxant. This essential mineral helps regulate muscle and nerve function, blood pressure and blood sugar levels. It's particularly important for heart rhythm and bone health. As we age, magnesium deficiency becomes more common due to decreased absorption, medication interactions, and dietary changes. Because of its many benefits, magnesium supplements have become increasingly popular among seniors. However, there's a common supplement that can dramatically reduce magnesium absorption when taken simultaneously: calcium. Yes, calcium, the very supplement many seniors take for bone health, can significantly interfere with magnesium absorption when taken at the same time. These two minerals compete for absorption pathways in the intestines, with calcium often winning due to its larger molecular size and concentration. Barbara, a 68-year-old retiree who had been experiencing muscle cramps and sleep difficulties, was diligently taking both calcium and magnesium supplements together each evening. Despite increasing her magnesium dose over time, her symptoms weren't improving. Her doctor discovered that by taking them together, she was sabotaging her magnesium absorption. "I was doing everything right, or so I thought," Barbara told me. "No one had ever mentioned they shouldn't be taken together. Once I separated them by several hours, my muscle cramps improved within a week." The competition between calcium and magnesium happens because they use the same transport systems in the intestinal tract. When taken together, these minerals essentially form a line at the same door, with calcium typically getting priority passage. Studies suggest that high calcium intake can reduce magnesium absorption by 30 to 40%. This interaction becomes especially problematic for seniors because magnesium deficiency is already common in older adults. Many seniors take high-dose calcium supplements for osteoporosis prevention. Magnesium plays a crucial role in heart rhythm regulation. Low magnesium can worsen muscle cramps, sleep problems, and anxiety, all common concerns for older adults. William, 77, experienced concerning heart palpitations that sent him to the emergency room. Despite taking a magnesium supplement specifically recommended by his cardiologist, his levels were still low. The cause? He was taking his magnesium with his high-dose calcium supplement every morning, significantly reducing its effectiveness. The solution to this mineral competition is straightforward: separation. Taking calcium and magnesium at different times of day allows each mineral its own window for optimal absorption. Many doctors recommend taking calcium with dinner when stomach acid levels are higher, aiding absorption, taking magnesium before bedtime, which can have the added benefit of promoting relaxation and better sleep, maintaining at least a 2-hour separation between these supplements. Dr. Elena Rodriguez, a nutritionist specializing in senior health, explains, the ideal calcium to magnesium ratio in the body is about 2.1. But when seniors take high-dose calcium supplements without adequate magnesium, or take them together, reducing magnesium absorption, this ratio can become severely imbalanced, affecting everything from heart function to nerve transmission. Some healthcare providers now recommend calcium-magnesium combination supplements that contain both minerals in the proper ratio, typically 2.1 calcium to magnesium. While these don't eliminate the competition entirely, they can help maintain a better mineral balance than taking high-dose calcium alone. It's also worth noting that certain forms of these minerals are better absorbed than others. Magnesium citrate, glycinate, and malate tend to be better absorbed than magnesium oxide. Similarly, calcium citrate is often better absorbed than calcium carbonate, especially for seniors with reduced stomach acid. If you're currently taking both supplements together, speak with your healthcare provider about the best timing strategy for your specific health needs. Simple adjustments to when you take these important minerals can make a significant difference in their effectiveness and your overall well-being. Beyond these 4 specific combinations, there's an important principle that many seniors aren't aware of: fat-soluble versus water-soluble vitamins, and how this distinction affects absorption, timing, and potential interactions. Vitamins are classified into 2 main categories: fat-soluble vitamins A, D, E, and K, and water-soluble B vitamins and vitamin C. Understanding the difference can help you maximize benefits while avoiding wasted money and potential health issues. Fat-soluble vitamins need dietary fat to be properly absorbed. Taking these supplements on an empty stomach or with a fat-free meal significantly reduces their absorption. I spoke with Harold, a 73-year-old who had been taking his vitamin D supplement first thing each morning with just a glass of water. Despite the high dose, his blood levels remained low. When his doctor suggested taking it with his fattiest meal of the day, his levels improved dramatically within months. Water-soluble vitamins, on the other hand, dissolve in water and don't require fat for absorption. These include all B vitamins and vitamin C. Your body takes what it needs and typically excretes excess amounts through urine. This is why taking extremely high doses of vitamin C often results in expensive urine rather than additional health benefits. This distinction becomes particularly important when considering supplement combinations and timing. For optimal absorption, take fat-soluble vitamins A, D, E, K with a meal containing some healthy fats like avocado, nuts, olive oil, or fatty fish. Water-soluble vitamins can be taken with or without food, though some B vitamins may cause mild stomach upset when taken on an empty stomach. Separate calcium from fat-soluble vitamin supplements, as calcium can interfere with the absorption of fat-soluble vitamins, particularly vitamin D. Dr. Martin Green, a pharmacist specializing in geriatric medication management, explains, "One of the most common mistakes I see is seniors taking all their supplements together first thing in the morning on an empty stomach. This practically guarantees that the fat-soluble vitamins won't be properly absorbed." This knowledge led Joyce, a 69-year-old with osteoporosis, to completely rethink her supplement routine. She had been taking her vitamin D, calcium and magnesium all together with her morning tea. After learning about these distinctions, she moved her vitamin D to dinner time, her fattiest meal, kept calcium with lunch, and took magnesium before bed. Within 3 months, her vitamin D levels had risen from deficient to optimal. The timing distinction extends beyond just meals. Some supplements are best taken at specific times of day. B vitamins, which support energy production, are generally best taken in the morning. Magnesium and valerian root, which have relaxing properties, are typically better before bedtime. Iron is often better absorbed on an empty stomach, but can cause stomach upset in some people. Calcium is better absorbed when split into smaller doses throughout the day, rather than taken all at once. Remember that these guidelines must be balanced with medication schedules, individual health conditions, and practical considerations. The perfect supplement routine on paper isn't helpful if it's too complicated to follow consistently. Martha, whom I mentioned at the beginning of this video, transformed her approach after learning these principles. Instead of taking all her supplements together with morning coffee, she now takes her B complex and vitamin C in the morning, calcium with lunch, vitamin D and fish oil with dinner, and magnesium before bed. Not only has this improved her nutrient levels, but she no longer experiences the fatigue and stomach discomfort that plagued her before. Now, let's explore 3 simple strategies that can help you create a safer, more effective supplement routine without needing a PhD in nutrition. Strategy 1. Create a personalized supplement schedule that works for you. Many supplement interactions can be avoided simply by proper timing. Here's a basic framework that works well for many seniors. Morning with breakfast, B-complex vitamins for energy, vitamin C, any supplements specifically recommended for morning use, midday with lunch, calcium, zinc, iron, if not taken on empty stomach, evening with dinner, vitamin D fish oil or omega-3 supplements, fat-soluble vitamins, A, E, K, bedtime, 30 minutes before sleep, magnesium relaxation or sleep supplements. This is just a starting point. Your specific health needs may require adjustments. The key is to create a routine that separates competing supplements while being simple enough to maintain consistently. Joan, 71, found that using a weekly pill organizer with multiple compartments for each day helped her keep track of her new schedule. "I was resistant at first, because it seemed complicated," she admitted. "But once I got into the routine, it became second nature, and I feel so much better knowing my supplements aren't fighting each other." Strategy 2. Regular supplement audits with your healthcare provider. Just as you might spring clean your closet, your supplement regimen deserves regular review. At least once a year, gather all your supplements, including vitamins, minerals, herbs, and any other products, and review them with your doctor or pharmacist. Frank, 80, discovered during such a review that 3 different supplements he was taking all contained significant amounts of vitamin A, potentially pushing him toward toxicity levels. Since vitamin A is fat-soluble and stored in the body, excess amounts can accumulate over time, potentially causing serious health problems. During your supplement audit, ask these key questions. Is each supplement still necessary for my health needs? Are there any duplications across multiple products? Have any new medications been added that might interact with my supplements? Is there a simpler approach that would provide the same benefits? Should any supplements be adjusted based on recent lab work? Many seniors are surprised to discover they're taking redundant supplements or continuing supplements they no longer need based on outdated recommendations. Strategy 3, consider food first, supplements second. While supplements have their place, obtaining nutrients from food provides benefits that pills simply cannot match. Whole foods contain complex combinations of nutrients that work synergistically, along with fiber and phytochemicals that support overall health. Dorothy, 75, had been taking a high-dose calcium supplement for years for bone health. When she experienced kidney stones, a potential side effect of excessive calcium supplementation, her doctor suggested focusing on calcium-rich foods instead. By incorporating yogurt, sardines with bones, and calcium-fortified plant milks into her diet, she was able to reduce her supplement dose while maintaining strong bones and eliminating the kidney stone recurrence. For many nutrients, food sources include calcium, dairy products, fortified plant milks, sardines with bones, leafy greens. Vitamin D, fatty fish, egg yolks, fortified milk, plus appropriate sun exposure. Magnesium, nuts, seeds, whole grains, leafy greens, dark chocolate. B12 animal products including meat, fish, eggs and dairy, omega-3s. Fatty fish like salmon, walnuts, flax seeds, chia seeds. Dr. Samantha Lee, a geriatric nutritionist, explains, I often see better results when my senior patients focus on nutrient-dense foods and use supplements strategically to fill specific gaps, rather than relying primarily on supplements for their nutrition. This doesn't mean abandoning supplements entirely. They remain valuable tools, especially for nutrients that become harder to absorb with age, like vitamin B12, or for those with dietary restrictions. The key is finding the right balance between food sources and supplemental support. Now, I want to address some common questions that arise when seniors begin to rethink their supplement routines. Will separating my supplements throughout the day really make that much difference? The science is clear on this one. Yes, it can make a substantial difference in how well your body absorbs and utilizes certain nutrients. Henry, 76, had been taking zinc and copper supplements together for years after reading about their importance for immune function. Despite this, he continued to experience frequent colds and infections. When his doctor explained that these minerals compete for absorption, he began taking them 2 hours apart. Within months, his immune resilience improved noticeably. The difference is especially significant for minerals like calcium, magnesium, zinc and iron, which directly compete for absorption pathways. Separating these can improve absorption by 30 to 60% compared to taking them simultaneously. I take so many supplements and medications already. How can I possibly separate everything without getting confused? This is a valid concern, and the answer isn't to create a schedule so complicated it becomes a source of stress. Margaret, 83, worked with her pharmacist to create a simplified system using a pill organizer with morning, noon, evening and bedtime compartments. She also kept a simple one-page chart on her refrigerator showing what to take when. For tech-savvy seniors, medication reminder apps can be helpful. Remember that an imperfect schedule is still better than taking everything together if there are known interactions. Focus on separating the most problematic combinations first and work from there. Does this mean I need to take more supplements to make up for interactions? Generally, no. The goal isn't to add more supplements, but to get more benefit from the ones you're already taking by preventing interactions that reduce their effectiveness. In some cases, better timing and absorption might actually allow you to reduce dosages under your doctor's guidance. Edward, 77, had been taking increasingly higher doses of iron for anemia without improvement. After learning to separate his iron from his calcium supplement and morning tea, which contains absorption-inhibiting tannins, his iron levels normalized on a lower dose than he had previously been taking. I've been taking all my supplements together for years. Have I been doing harm to myself? If you haven't noticed any negative effects, there's no need to worry about past habits. The human body is remarkably adaptable. However, Now that you have this knowledge, you can optimize your routine going forward for better results. Think of it as an opportunity to get more value from your supplements rather than a cause for concern about the past. Should I just stop taking supplements altogether? This would be throwing the baby out with the bathwater. Targeted supplementation can be valuable, especially for seniors. Age-related changes in digestion, absorption, and nutrient needs make certain supplements particularly beneficial for older adults. The key is being strategic about which supplements you take, when you take them, and how you combine them. Joyce, 78, experienced significant improvement in her energy and cognitive clarity when she began taking vitamin B12 supplements under her doctor's guidance. For her, eliminating this supplement would have meant returning to troubling symptoms of deficiency. What about prescription medications? How do they fit into all this? Prescription medications add another layer of complexity to timing considerations. Some medications need to be taken on an empty stomach, others with food. Some interact with specific supplements or foods. This is why it's essential to include all supplements in discussions with your healthcare providers and pharmacist. They can help you create a comprehensive schedule that accounts for both medications and supplements. Don't hesitate to ask specifically about timing and potential interactions. It's a crucial question that too often goes unasked. Harold, 84, discovered that his blood pressure medication was less effective when taken alongside his magnesium supplement. By separating them by 3 hours, as recommended by his pharmacist, his blood pressure control improved significantly. Now that we've explored these important supplement interactions and strategies, let's take a moment to reflect on why this information matters so deeply for seniors. As we age, our bodies become both more in need of nutritional support and more sensitive to interactions and imbalances. The margin for error narrows. What might have caused no noticeable issues in your 40s or 50s can create significant problems in your 70s or 80s. At the same time, the consequences of nutritional deficiencies become more serious. Vitamin B12 deficiency that might have caused mild fatigue in middle age can contribute to balance problems and cognitive issues in seniors. Calcium and vitamin D inadequacies that might have gone unnoticed earlier in life can accelerate bone loss and increase fracture risk later. This isn't meant to cause anxiety, but to emphasize the importance of being thoughtful about your supplement routine. The goal isn't perfection, but improvement, making reasonable adjustments that can significantly enhance your well-being. Remember Margaret from the beginning of our video. After learning about these interactions and working with her doctor to create a more strategic supplement schedule, her energy returned, her digestive complaints resolved, and she felt more clear-headed than she had in years. "I thought I was just getting older," she told me. "I had no idea my well-intentioned supplement routine was actually making things worse." Your body deserves the same care and attention. By being mindful about which supplements you take together and when, you're not just avoiding negative interactions, you're actively supporting your body's natural healing and maintenance systems to work at their best. I encourage you to take what you've learned today and have a conversation with your healthcare provider about optimizing your supplement routine. Bring a list of everything you take, including the exact doses and times. Ask specifically about potential interactions and optimal timing. Many doctors appreciate patients who take an active role in their healthcare, and this conversation could yield insights specifically tailored to your unique needs. If you found this information helpful, please give this video a thumbs up and share it with friends or family members who might benefit. In the comments below, I'd love to hear about your experiences with supplements. Have you noticed differences when changing how you take them? Do you have questions about specific combinations not covered in this video? Don't forget to subscribe to our channel for more evidence-based health information designed specifically for seniors who want to live their best lives. We cover everything from nutrition and exercise to sleep quality and cognitive health, always with a focus on practical, actionable advice. Remember, knowledge is power, especially when it comes to your health. Small, informed changes to how you approach supplementation can make a meaningful difference in how you feel each day. You deserve to get the maximum benefit from every supplement you take, and now you have the information to make that possible. Thank you for joining me today. Until next time, here's to your health and vitality in every stage of life. Wait, before you go, I realize there's something important we haven't discussed yet. How to know if you're experiencing negative supplement interactions right now. Let's cover some warning signs to watch for that might indicate your current supplement routine isn't working optimally. Unexpected fatigue or energy crashes could signal that supplements are working against each other or not being properly absorbed. If you find yourself unusually tired despite taking supplements meant to boost energy, it's worth investigating possible interactions. Digestive disturbances like nausea, constipation, or diarrhea sometimes indicate that supplements are competing or overwhelming your digestive system when taken together. Spacing them out often resolves these issues. New or unusual symptoms that appeared after starting supplements should never be ignored. While not always due to interactions, they're important clues that something in your regimen may need adjustment. Worsening of the very conditions you're trying to address with supplements is particularly telling. If your joint pain increases despite taking anti-inflammatory supplements, or your sleep deteriorates despite taking supplements meant to improve it, interactions might be the culprit. Lab tests showing continued deficiencies despite supplementation suggest absorption issues, possibly from taking competing supplements together or with medications that interfere with absorption. If you recognize any of these patterns, don't make drastic changes on your own. Instead, document your symptoms, supplement routine and timing, then consult your healthcare provider for guidance on adjustments. I also want to emphasize the importance of quality when it comes to supplements. Not all products are created equal, and sometimes what appears to be an interaction issue is actually a quality problem. Look for supplements that have been third-party tested for purity and potency. Organizations like USP, United States Pharmacopeia, NSF International, and Consumer Lab provide verification programs that can help you identify reliable products. Remember that the supplement industry isn't regulated as strictly as prescription medications. This means the quality, potency, and even the actual ingredients can vary significantly between brands and products. Choosing reputable brands from established companies can help ensure you're actually getting what the label promises. Dorothy, 81, struggled with stomach upset from her calcium supplement for months. When she switched to a higher quality brand with a different form of calcium, citrate instead of carbonate, her digestive issues resolved completely. What seemed like a potential interaction was actually a quality and formulation issue. As we conclude, I want to leave you with one final thought. The goal of taking supplements isn't just to consume nutrients. It's to support your body's natural processes and enhance your quality of life. If your current approach isn't accomplishing that, it deserves reconsideration. Your health journey is exactly that, a journey, not a destination. Being willing to adjust, learn, and optimize your approach as new information becomes available is a sign of wisdom, not weakness. The small changes we've discussed today could make a significant difference in how you feel tomorrow, next month, and in the years ahead. Thank you truly for spending this time with me today. I hope you feel empowered to take a fresh look at your supplement routine with an eye toward maximizing benefits while minimizing potential problems. Your health matters, and you deserve to get the most from every effort you make to support it. Until next time, take good care of yourself and remember that small, informed changes often lead to the most significant improvements in how we feel and function every day. Oh, I almost forgot to mention one more important thing, the role of hydration in supplement effectiveness. This might seem basic, but it's surprisingly overlooked. Many seniors become less sensitive to thirst signals as they age, leading to chronic mild dehydration. This can significantly impact how well your body processes and utilizes supplements. Without adequate water, tablets may not dissolve properly, absorption can be compromised, and your kidneys may struggle to properly process water-soluble vitamins. A simple practice of drinking a full 8-ounce glass of water with supplements can make a noticeable difference in their effectiveness. This is especially important for supplements known to cause digestive discomfort, like iron or zinc, as adequate water can help minimize irritation to the stomach lining. Eleanor, 79, found that simply increasing her water intake throughout the day, especially when taking supplements, reduced her digestive discomfort significantly. "I never realized how important water was to how my supplements worked," she told me. "I always took them with just a few sips, thinking that was enough." Bril. For optimal supplement absorption, aim to drink at least 8 ounces of water when taking your vitamins and minerals. Additionally, maintaining good hydration throughout the day supports your body's ability to transport nutrients to cells and tissues where they're needed. This brings us to another aspect worth discussing, the role of digestive health in supplement absorption. As we age, many of us experience changes in digestive function that can affect how well we absorb nutrients from both food and supplements. Lower stomach acid production, reduced digestive enzyme activity, and changes in gut bacteria can all impact nutrient absorption. This is why some seniors find they need higher doses of certain supplements as they get older. Not necessarily because their needs have increased, but because their absorption efficiency has decreased. Supporting your digestive system can enhance supplement effectiveness. Simple practices like thoroughly chewing food, eating mindfully without rushing, and including fermented foods like yogurt or sauerkraut in your diet can promote better digestive health. For some seniors, digestive enzyme supplements taken with meals can help maximize nutrient absorption from both food and supplements. Richard, 83, had been taking vitamin B supplements for years with limited benefit. After working with a nutritionist who recommended adding a digestive enzyme supplement with meals, he noticed significant improvements in his energy levels and cognitive clarity within weeks. I also want to touch on seasonal variations in supplement needs, something rarely discussed but potentially important. Your body's requirements for certain nutrients can change with the seasons. The most obvious example is vitamin D, often called the sunshine vitamin, because your skin produces it when exposed to sunlight. During winter months in northern climates, many seniors become deficient in vitamin D due to reduced sun exposure, heavier clothing, and less time outdoors. This might necessitate higher supplemental doses during winter compared to summer. Similarly, vitamin C needs may increase during cold and flu season to support immune function. Being flexible with your supplement routine to accommodate these seasonal variations can help you maintain optimal health year-round. Martha, 76, works with her doctor to adjust her vitamin D supplementation seasonally, taking 2,000 IU during summer months and increasing to 4,000 IU during the winter when she spends less time outdoors. This approach has helped her maintain consistent levels throughout the year. As we approach the end of our discussion, I want to acknowledge that navigating the world of supplements can feel overwhelming. There's so much information and misinformation available that knowing what's right for your specific situation can be challenging. This is why personalized guidance from healthcare professionals who understand your complete health picture is invaluable. While general guidelines like those we've discussed today provide a helpful starting point, your unique health conditions, medication regimen, and even genetic factors can influence what supplement approach works best for you. Don't hesitate to seek professional guidance. Many pharmacists offer medication and supplement reviews, sometimes at no additional cost. Registered dietitians can provide personalized nutrition and supplement recommendations based on your specific health goals and challenges. And of course, your primary healthcare provider should always be informed about all supplements you're taking. James, 85, was taking 11 different supplements based on recommendations from friends, magazine articles, and internet research. Working with a geriatric pharmacist, he was able to eliminate 5 unnecessary products and better organize the timing of the remaining supplements. Not only did this save him money, but his energy improved and several nagging symptoms resolved. I hope our conversation today has empowered you to take a more informed approach to your supplement routine. Remember that supplements are tools to support your health. They work best when used thoughtfully, in the right combinations, and at the right times. Your body has an incredible capacity for healing and maintaining wellness when given the right support. By avoiding problematic supplement combinations and being strategic about timing, you're partnering with your body's natural wisdom rather than working against it. Thank you for staying with me through this extended discussion. Your commitment to understanding how to optimize your health is inspiring. If you have specific questions about your supplement routine, I encourage you to note them down and discuss them with your healthcare provider at your next visit. In the meantime, start with small changes. Perhaps begin by separating those calcium and iron supplements or moving your vitamin D to your dinner time. Small adjustments can lead to significant improvements over time. I wish you vibrant health and wellness on your continued journey. Until next time, take good care of yourself. You deserve it. One last thought before I go. Remember that while supplements can be valuable tools for supporting health, they're just one piece of the wellness puzzle. Regular physical activity, quality sleep, stress management, and meaningful social connections all play crucial roles in how we feel and function, especially as we age. The most effective approach to vibrant aging combines thoughtful supplementation with these other pillars of health. A daily walk in nature, a good night's sleep, time spent with loved ones, and a nutrient-dense diet work synergistically with well-chosen supplements to support overall well-being. William, 88, credits his remarkably good health not just to his carefully planned supplement routine, but to his daily ritual of walking 2 miles, tending his garden, playing chess with friends, and cooking nutritious meals from scratch. The supplements help, he told me with a smile, but they're part of a bigger picture. As you optimize your supplement routine based on what we've discussed today, consider it an invitation to look at other aspects of your health practices as well. Small improvements across multiple areas often yield better results than focusing exclusively on supplements alone. Thank you again for joining me today. May your journey toward optimal health be rewarding, and may each day bring you renewed energy and vitality. Until we meet again, be well.